Okay. I think Dr. Day.
Yes, Aparajita.
Yes. Can you sort of, can you see the next slide over here?
No.
Okay, right.
Still
Can you see it now?
Yeah.
Okay,
It's
great.
visible now. Yes, great.
Yeah. Thanks. So the agenda for today is we're going to be see the next slide over launching the Novum Nexum series promotional video.
Still
Can you see it now?
Yeah.
Okay, great. We'll be talking a little bit about the biotechnology development program. So the agenda for today is
And how
we
we
see the next slide over here.
thought about integrated series
promotional video.
Biotechnologies.
We'll be talking a little bit about
Dr. Day and myself
So the agenda for today, the session. So I'll be taking up the first three portions, and then Dr. Day will run you through the introduction to the actual course in health analytics. He'll talk you through the reasons why health analytics is important and why we're choosing this particular topic as our first launch. And then he'll talk to you a little bit about the healthcare analytics adoption model framework that has a basis on the clinical data analytics, and then we'll talk a little bit about the employment projection. You'll be advised regarding the topics in the health analytics course and the career options as well, and then we'll go to our speakers who've been very kind, Professor Chakrabarti and Dr. Bhowmick, and then we go into the question answer series. So just for the sake of getting this through easily, I would request you to please mute your your mic so that we can just go through the session, and then we'll opt for the question and answer session later on. Thanks.
Original program টা back কর
That was the promotional video for the Novum Nexum series, and the Novum Nexum series are future-ready courses with a framework based on integrated thinking, something that we'll be talking about in a little while, for assisting students and professionals with knowledge production and exchange, and to enable them with a sustainable career transition into the healthcare industry. All this backed up with a proven industry and academic connect strategy. And the courses are crucial for healthcare industries looking to upskill and cross-skill their human resources in the post-COVID scenario. Am I audible, everybody?
Yes, perfectly audible, yes.
Thank you. So SHRM Biotechnologies Private Limited, in association with Astrit Research and Advisory Services, have come up with the Novum Nexum series with a focus on biotechnology management development programs. And the main aim is to deliver and conduct these BMTPs to corporate professionals and students, which would include training workshops for a specific duration of time, again harping on the importance of integrated thinking approach. Ultimately, so that students and corporate professionals can move into the different departments within the healthcare industries, opt for a new career, and finally to gain the skills in order to optimize biotechnology operations management using emerging technologies and various policy frameworks. So that was the thinking behind us launching the biotechnology management development programs under the Novum Nexum series. A little bit about the integrated thinking in the courses that combine management, IT, and biotechnology. So the first of the courses, the micro-credential course that we're rolling out is health analytics. However, we do intend to roll out these courses in biotech, IT, perhaps supply chain management, and that broadly deal with the strategic operational application of IT and management in the fields of biotechnology and other allied sectors of the health industry. So it employs an integrated thinking approach, as discussed earlier, which assists students in the way of thinking on how to optimize information flows, reporting on management, analysis, and finally filters down to ultimately proper decision-making in the field. This particular slide gives you an idea of how the micro-credential courses, or the integrated courses that we'd like to call it over here, employs the integrated thinking approach in the development of the biotechnology management development programs. So the things that you can look forward to while you you kind of curate these courses and you sort of gain the credentials little bit are long-term organizational success, because these are the building blocks for you to perhaps get into a new direction in your career and also gain those skills which are going to be required in the industry. It's going to assist you to break down the internal silos so you can have the proper skills to talk to your IT person in the healthcare industry and making sense of all the data, which is very important in today's world. Again, if you are opting to sort of play a crucial role in the decision-making of the firm, then the knowledge that you're going to be receiving from these micro-credential courses are going to assist you with shared understanding of value creation for your industry and your organization. And obviously, it's backed up with enhanced communication through connecting relevant people and information. And that will ultimately assist in improved decision-making for management at all levels. So we're training you to become health biotechnology managers from the beginning. And all this funnels through to the biotechnology management development programs. So that's the introduction from my side, and apologies for the slow start. But now I'd like to request Dr. Day to perhaps walk you through the introduction to the health analytics actual course and talk to you a little bit more about what's in it and what's required. Thank you.
Yeah, thanks, Aparajita. I'll quickly run through the slides because I'd give you more. I think I should give more time to the speakers because you should listen to them more than what we want to bring across. So, introduction to health analytics. This is clinical data analytics, as you can see, different names. Extrapolation of actionable insights from sets of patient data typically collected from electronic health records. Traditional claims-based analytics alone no longer address the problems that arise from too few resources to too many patients, and with the sheer amount of clinical data available, it is understandable why this methodology is desired. So the idea is too much of data, but no interpretation. So how does it help? Now, we biologists, till the year 2000, we have been complaining that there is not enough data. But then after the year 2000, if you see, we have been bombarded by data. And we don't know what to do with so much of data. That is where the bioinformatics comes in. That is where the biomathematics comes in. That is where biostatistics comes in a way that will give you a direction to understand and interpret the data. And that is where, again, this course becomes very important. The analytics part of the course becomes very important. Next slide, Aparajita, please. Okay, so it says, what's it's not? So some misconceptions about health analytics. It's a new course, guys. I mean, maybe quite a few of you have heard about this already, but many have still not heard about it. So chances are that there can be a lot of misunderstanding. So quickly to clear on that, is not simply the application of business techniques to health services. So it is not only about making a business, okay? It also involves techniques for analysis of health services that require in-depth understanding of the workings of the health system and are grounded in a rational, comprehensive public health model of health administration. So you see, it's a wholesome, what should I say? It's a wholesome structure that gives you a wholesome outlook. So it's not in parts, it's not in silos. You get to work as a team, you get to see the whole picture. So that's very important. Next slide. Clinical data. What is clinical data analytics? Clinical data analytics follows the healthcare analytics adoption model framework that was developed by a cross-industry group, classifying groups of analytics capabilities, and number two, providing systematic sequencing for adapting them. So you see, it's very important. Can you go back to the previous slide quickly? Aparajita, previous slide? Yeah, thank you. So healthcare analytics adoption model framework, it's a cross-industry. So you can understand that we are not only focusing on one aspect. We understand that there are multiple aspects to our program. And when you are in it and doing something, then you require the inputs coming from different organizations and different setups. So that is where this course becomes very effective because it is multidimensional and has multiple inputs. Next slide. Okay, so this is the framework, the model framework that you see. I'm just going to quickly read this out. So from level 0 to level 8, you start with fragmented point solutions. Then you have this enterprise data warehouse, standardized vocabulary patient registers, and then automatic internal reporting, followed by automated external reporting, waste care reduction, PHM suggestive analytics. And at the highest level, you get to do clinical risk intervention and predictive analytics. Personalized medicine and prescriptive analysis. Now this level 7 and level 8 is my personal favorite as well. It's extremely interesting, and I think the the speakers are going to elaborate and talk about this a little also. And you'll be excited when you get to do this hands-on, because this will give you multiple dimensions in understanding medicine and the beauty of it. Okay, next slide. So these are some of the statistics which talks about the technical advancements which has been impacting healthcare. 22.6% increase in healthcare support occupations, 9.2% increase in healthcare practitioners and technical occupations. So nurses, occupational theory, therapy assistants, physical assistants, physician assistants are projected to be in greater demand as a team-based healthcare models using IT and analytics are increasingly used to deliver healthcare services. So you see, like in most of the industry today, we are trying to automatize it, and bringing IT interpretations and data analytics. So here also it is the same. It is no longer an industry which is only dependent on manpower, only dependent on care, but very intelligent care. So, and that is where that intelligence comes from, the IT part of it. Next slide. Okay, so this is very simple. This is basically the module that definitely are there in this. Emerging topics in health analytics, deep learning for healthcare analytics, introduction to healthcare analytics, data science in healthcare, machine learning, quantitative techniques, analytics, and Python. So you see, it's a mix of IT, management, medicine, data analytics. So it's a mix of, you'll have a flavor of all the subjects. And this is very important because please understand, when you are working in the industry, you can be a specialist in one subject. But then if you really want to grow the ladders, if you really want to, become or reach the levels of senior management, it is very important that you have an understanding of what is happening in the company from any segment. And therefore, this is like a bridge course which tells you about the basics as well as upon some of the intricacies which is needed to grow up the ladder. So definitely it is also going to help you in career enhancements. Next slide. Career options. Now this is something all of you would be interested in. If I do this course, then how is it going to benefit me? What is it that I'm going to, where is it that I'm going to find a job, or where is it that I can start an entrepreneurship? So you can see, it's like working with pharmaceutical companies, health IT vendors, health IT consultants, and I can tell you this is a huge segment now because there are many jobs in the health segment which is now getting outsourced, and there are many companies which are coming in, and they will be needing your help if you are an expert in this subject. Demand for health informatics professionals in hospitals and healthcare providers, public health organizations, governments, NGOs, academic research, clinical data managers, chief medical officers, clinical information manager. Now, this is very, very important. One of my friends, he's already in this role, and I can tell you he's doing amazing. He's anyways a very dynamic guy, but he's changed the whole concept of the system of taking exams or system of giving exams online. So, already this is happening. Consultant, healthcare webmasters, information security, risk, revenue, privacy managers. As a health informatics professional, you will organize the evidence used in evidence-based medicine. You will help support patient care, teaching, research, quality improvement, and legal inquiries. One of the areas that we are looking at in future, of course, it has already come to many developed countries. I am not very sure that how well it is doing in India, but it is definitely creeping in, is like genetic counseling. So if you look at these segments and personalized medicine, where we are saying it is very important that we don't go for generalized medicines, generalized treatments, where we understand a person, his requirements to the absolute molecular level. And all this won't happen without the help of the health analytics. And there you can play a very, very important role, a life-changing role, and it's very satisfying as well, that you will be able to contribute in changing lives of people. Next. Next slide, Aparajita. Yeah. So I think we have the speakers now, and I think Aparajita is going to do their introduction. Aparajita, please.
Thanks, Dr. Dey. So we'd like to introduce our speakers for tonight. We have Professor Chakrabarti, who is the head of Information Technology and Technology Innovation Cell, Government of West Bengal Department of Higher Education. He is also the professor and director of A.K. Chaudhary School of IT, University of Calcutta. And we also have Dr. Bhowmick, the clinical director, Peerless Hospital and B.K. Roy Research Center, and also consultant in the digital health programs at Macau. So they will be speaking to you regarding the efficacy of these courses and the impact it will have in your long-term career transition and growth and opportunities as well. So over to you. We'll start with Dr. Bhowmick. Dr. Bhowmick?
Yes. Am I allowed to kind of share a couple of slides, if that is allowed?
Absolutely.
I mean, just adding to what has been said.
Mm-hmm.
So good afternoon, everyone. Good evening, in fact. So I'll just pull in a couple of slides. Okay, go to the share now. Okay. So this has been said already. I just want to continue. So whatever has been said, I just want to bring to your attention what is the Indian scenario. Are my slides visible?
Yes, Dr. Bhowmick. Yeah.
Okay, so at the outset, thank you for inviting me for this discussion and this important session on healthcare analytics. And healthcare analytics, my perspective is from the hospital end. And I give a disclaimer that I am not actually an IT person or an engineer, but we are seeing at the healthcare sector that this particular division is growing. And in a country like India, we have humongous potential. And this is not what me, as in, a director for clinical research or academics believes. But the article which was published in Business Wire in May 2020, this speaks volumes that how healthcare analytics market is growing in this country. So for the students who are attending this particular program, I think this is extremely important for you to understand that if there are job opportunities in courses which you are undertaking. So in 2019, the healthcare analytics accounted for 10.8% of the digital healthcare market in India, and digital healthcare market has grown leaps and bounds in the pandemic. So I can just give you statistics of the online digital platform, the consultation platform Practo. Practo's business has grown 200% in last 2 years, and especially when the pandemic has hit. So hospitals, they are all embarking on the digital health, telemedicine pathway, and it is expected that the healthcare analytics market will reach the value of 7 billion Indian rupees by the end of 2025. And there is a huge expansion which is happening in this field. So definitely courses like this which has been discussed, they have takers and they really have the reason why this is expanding is because there's an increased focus on collection and analysis of data from different healthcare sources for improved customer service, and we are ourselves doing it. Peerless Hospital has launched the telemedicine software. We are undertaking, we have data now, electronic data of consultation, where these patients have consulted on a digital platform. Our entire radiology and lab departmental reports, they are in the electronic format, and we are sitting on heaps and heaps of data. In fact, we are planning to go the digital way in writing prescription as well. We have started the process. And India is also witnessing technological advancements, and I think the COVID-19 pandemic has acted as a catalyst, if I could use that word, for technological advancement. And for the students who are sitting here, it's so difficult to bring in laws in this country because it needs to be passed by the lower house as well as the upper house of the parliament. But the Indian telemedicine practice guidelines, they were cleared by both houses in a record 1 month time in March 2020, when pandemic was about to begin in this country. So telemedicine is a reality in this country, and according to a statistical analysis, over 60% of the people have, in the urban scenario, the doctors have moved into telemedicine consultation home. There is also, if you see, within the country, there is a rising adoption of EHR, which is electronic health records. And this has humongously grown in the last few years, I would say, personally, because I've been attached to the hospital which uses the electronic health record. Electronic health records, and this is expected to drive the growth of healthcare analytics market in this country massively. Finally, my last slide will be that pandemic. We all know that pandemic is gripping us. Our lives have changed. Lives no longer continue to be same, and everyone has been affected by this deadly disease, or I would say their near or dear one. And artificial intelligence is now expected to contain this pandemic globally. AI and healthcare analytics will play an important tool to fight the deadly coronavirus. And already in the developed world, healthcare providers and professionals have been using AI and machine learning to track and contain coronavirus infection. And this has started in India as well, though this is very sketchy in India. But then definitely, as a sizable portion of the in India still are without vaccine, we still would see COVID-19 existing in us for a longer period of time. So I definitely see that AI-driven solutions in COVID-19 are going to be the future in this country. And predictive analytics, I'm sure Dr. Chakrabarti is going to talk about the different kinds of healthcare analytics tools. And predictive analytics is one of the healthcare analytics tools, will help healthcare data scientists and researchers to analyze the patient data, which we have currently in Peerless. Also, we are doing a cross-functional project with Professor Chakrabarti, and we are about to publish that data. And this is a great example of cross-functional work which we are planning to do. And these have been large patient data set which can give us information on what is working and what is not working in COVID-19. So to summarize, I would say that definitely healthcare analytics is a field which is growing exponentially. And whether we like it or we don't like it, COVID-19 is playing an important catalyst in the growth of healthcare analytics as a field. So this is from my side. I would be happy to answer questions related to the applicability as well as the practical implementation of the courses at the healthcare end. Thank you.
Thank you, Dr. Bhowmick, for the elaborate explanation about the importance of analytics and health analytics in today's world, especially post-pandemic. I'd request Professor Omlan Chakrabarti from Calcutta University to please address the viewers regarding his perspectives on the courses and the efficacy of the course and the techniques employed by the courses. Professor, over to you.
Yeah, thanks, Aparajita. Thanks to the SHRM Biotech and Astrit initiative of in this particular course, which I think health analytics is the course at the present scenario is one of the courses which I think the students will love to teach. Okay, but this is a very interdisciplinary course, and as Dr. Bhowmick rightly said, that it involves two knowledge domain. It intersects two knowledge domain. One is the knowledge domain of clinical practice, and another one is the computer science or information technology. With that, obviously, a lot of interests are there. Okay, for the students and researchers who are also there in biotechnology and biochemistry and related fields. Now, it's also a very huge, or a lot of things can be covered in this particular course, but I think as Dr. Devoshi has rightly listed the topics, I find the topics are very interesting and they are very focused. My area of expertise, okay, is basically artificial intelligence, and I am doing a lot of works in this particular domain, and Peerless and Dr. Bhowmick is also a very core part of my research activity. So Aparajita, if you permit, I can just present 3 or 4 slides just to motivate the students that what are the exciting things they can do in the domain of medical image analysis.
I think we would all love that, Professor. Please go ahead. Thank you.
Perfect. Okay. Sorry. Okay. Got it. Okay, is my slide is visible to all of you, right?
Yes.
Absolutely, sir. Absolutely.
Okay, so this is the domain where it is very interesting. Apart from obviously the predictive analytics, what Dr. Bhowmick said, that is also one of my core domain. But due to a limitation of time, I will try to highlight some attractive figures and facts so that you get interested. Okay. So this is the world of medical imaging, right? And this is the research activity I am doing the medical image analysis I am doing for the last 8+ years, almost 8+ years. So the issue here is that you have different modalities of images, and they are taken from different equipments, right? And it incorporates a lot of medical expertise, right? Actually, in capturing the image, the expertise of computer science is pretty less, right? It is just only capturing the data in the memory. But what to capture, how to capture, what modality to capture, depending on the patient condition, these are all suggested and directed by very expert medical experts. Okay. The complexity here is that if you look into the complexity, what we have to address here, okay, both from the doctor's side and both if we want to do the AI or machine learning type of activities on this data, there are a whole lot of different types of images, and these are of different organs, right? Different different modalities. Suppose we want to go for the soft tissues, we will go for MRI. Suppose we want to go for the hard tissues, we will go for the CT, right? And there are some organs which are non-rigid, right? We have to take different types of signals from them, right? Like ECG or EEG type of signals to understand their dynamic scenario. The ultrasounds are there, which are also tries to capture the signal when it is deeply seated inside a particular watery sac in the body, the organs which are deeply seated, in that particular region of the body. So there is a variety and variability in the data itself, and that's why we have a variety and variability of analytics process to understand this data. There is also another part which Dr. Bhowmick and I think Dr. Deboshi has also rightly said, that this is the major thrust is also that how we can store the data, how we can archive the data, how we can make the database very efficient, right? So that we can access the data and we can process the data and we can churn out the decisions. And so we require different types of database storage applications which are very well planned for this domain of applications like PACS, RIS, as well as the DICOM, which is one of the format for exchange of image data in the medical domain, right? And there are a lot of communications, a lot of protocols happens, right? This is these are done by the medical team with the health analytics professionals, right? So this is also a very important activity when you learn the health analytics. Okay, it is not only that you do analytics, but you also learn how the data is handled and what are the different modalities, what are the different protocols by which the data is handled in a very standard medical practice. Now, the interesting part where AI and ML comes into a great play is computer-aided detection and diagnostics. So computer-aided detection means that can we have automated tools which can try to figure out or localize the deformities from the different modalities of medical images depending on the different type of organs, like the chest X-ray of lungs. We can try to find out the nodules in the digital X-ray. We can try to find out the tumor or the lesions, from the brain MRI or from the spine MRI. So this is the step one, which is meant by detection. But obviously, the radiologist and the medical expert assist this process because there are a lot of the algorithms what we try to develop here needs to be in the same approach or needs to satisfy the requirement of the radiologist as well as the medical expert. The next step of this is that suppose we have detected the deformity, can we predict the risk in that, and can we try to capture the prognosis of the disease, right? And there are techniques and tools which are coming up in a great way, and this is also one major focus of health analytics. The world of machine learning has a lot of variety, and it is just expanding or evolving in a very great way. I'm not getting into this because this is not a formal course I'm taking here, but just to inspire you that lot of things are coming up in the machine learning and the medical experts along with the computer science or IT experts are now trying to solve a lot of problems in the health analytics using machine learning as one of the core tools. So So if you look into the next generation of machine learning is called the deep learning, which is very much taken by the deep neural processing which happens in our biological world, and we have a lot of different types of complex network processing which processes the data, and we have seen that the deep learning or deep networks can also play a great role in the present scenario of computer-aided detection and diagnosis. So this is a multi-layer. If you look into the processing of deep learning, how it differs from the traditional processing, it's a multi-layered processing where we have a number of processing nodes which are formally called as neural nodes. Again, not getting into the details of that, but the good part of this is that it has a very similarity with the way our brain processes, because we know that our brain has a lot of functional layers, and the deep networks try to extract the different abstractions from your data, in the different layers of the network, and try to understand or try to predict about the data in a very accurate way. And that's why the success of deep networks, of deep learning, and as we know, the medical image processing is one of the most complicated domain of image processing, computer vision, and that is a very core part of health analytics. So the task that we try to do in the medical image analysis in context to health analytics is that we try to classify the objects, whether it is a lesion or non-lesion, whether it is a tumor or it is not a tumor, right? Then we try to localize, if the lesion has occurred or if the tumor is detected, whether it is in the frontal lobe or whether it is in the other lobes, whether it is in the left side or right side, or if it is in the spine, in which vertebra of the spine it is. So these are very important aspects of diagnosis which are done. This process obviously involves segmentation. Segmentation means that you are trying to extract the region of interest, and you are trying to focus more on that region of the image instead of the other region, because that helps to extract or understand the features of a particular region in a better, and try to detect and go for the positive diagnosis. The case of registration is something we require also in the case of image analysis for health analytics, because we have the multimodal image. The same tumor can be traced in the city, or similarly in the PET. So PET gives a sort of image which tells you that how the in the particular cellular activity goes on in this particular part of the region of the organ, whereas CT gives you the more structural information. So you need to know that whether the region is biologically active, which is one type of feature, and you also need to know that what are the exact shape, size, and area of this particular region. So we need to fuse the two modalities of image, and that's also one of the activities that we do in this particular medical image analysis. And deep learning techniques are very well used. So the conclusion, what I want to say is that this is a very interesting domain, and it is not that we have solved lot many problems. It is only we have solved a few problems in this domain, and this is a very interesting domain in terms of developing tools to help the doctors. And we know in a country like India that we don't have enough doctors. So one of the primary goal of this particular domain is that how to help doctors to serve more patients, and how to apply the processes like telemedicine or telesurgery in the long run, so that our rural areas and the areas where we don't have enough doctors to cater the population can be well served, right? And the challenge is that how health analytics can step up, okay, in terms of accuracy, in terms of sensitivity of this analysis, because these, okay, we have to remember that the computer or computational process, what we do in the normal course, okay, doesn't has a direct impact on the life of an individual. But when we try to say that we are doing health analytics and we are working with the health data and we are trying to do a prescriptive or predictive analytics, okay, it has a huge impact on the human population, and so we need to be very focused and we need to be very accurate. So these are the challenges, and I hope that this particular course, what is being planned and prepared, will be very effective in guiding the students or helping the students to know the integrities of data handling, data processing, analytics, using the data, and also building the tools and software techniques so that there can be a real contribution in this domain. Thank you.
Thank you, Professor Chakrabarti, for that very elaborate and insightful presentation on the impact of machine learning and deep learning on medical image analytics and health analytics in general. Dr. Dey, I'd request you to perhaps maybe look into the questions. Should we move into the questions now?
Yes, absolutely. I think we can have the questions from our audience, and that would be lovely. Yeah.
May I request the audience and the viewers to perhaps post your questions in the chat box so that we can address it and direct it to the specific speakers we're intending to ask the question to, please. Any questions?
May I ask any question, sir? Hello.
Yes, Mr. Chanda.
I want to know one answer about the accuracy of medical imaging. It differ from laboratory to laboratory. That's why the diagnosis and analysis of the disease is become very difficult. How it can be more accurate?
Okay, this is so shall I answer it, Dr. Bhowmick?
Yes, please go ahead. Please.
Okay, yeah. So this is a good question. See, whenever we do processing, of any data, right, and especially we are trying to extract an information out of it. Okay, the fundamental question is that how accurately we are extracting the information. Now, in the case of medical image analysis, right, it depends on how we are doing it. So when you tell that it varies from lab to lab, right, because the instruments are different, right? So I think Dr. Bhowmick can also add to this different instruments. So normally this was a very good discussion with one of the doctors. When I said that see, when we go for a city, right, and we go to a lab which tells that you can do it in X rupees, right, and I go to another lab and it tells that you have to you can do it Y rupees, where X or Y is much greater than X, and normal motivation is that Y is charging too much, right, so let's settle down in X, right? And what happens here is that if we try to take a city image, right? City image goes with the number of slices, the depth of the slices you take, the cuts you take, whether it is a 3 millimeter, 1 millimeter, or 5 millimeter cut. So if I am using an instrument which is generating 5 millimeter cut, I can make it in a very reduced amount of time, and I can give the city with a lower price. But an instrument which is going for a 1 millimeter cut, it is generating more number of cuts and is spending a more machine time, and so it is charging more. But in perspective of a patient, what I get in 1 millimeter cut is that in a 1 millimeter cut, I can resolve the dimensions of that order. right? In a 5 millimeter cut, I cannot resolve the dimensions which are less than 5 millimeter. So my accuracy is dependent very much on the data what is presented to me, right? And the next, in terms of the processes, okay, the processes are pretty standard. Benchmark processes are nowadays available. Nobody can claim anything, okay, in the image processing domain unless it is validated by a medical expert. And when you tell that it is being practiced in a formal laboratory, okay, considering that all the standard practices have been maintained, this means that it has been validated by multiple agencies, right? So there shouldn't be much problem in terms of the tools. Again, saying that whether the tools is coming from a standard practice tool or whether it is just a makeshift tool, okay, which a lab is practicing, that again puts a question on the accuracy. So whenever we're going for a sophisticated type of approach, I think you need to depend on the machinery and as well as the quality of the tool, which should be well supported by the standard practices. Okay, that's all from my side.
Sir, I want to say that being the general public, a patient cannot decide where he has to go for medical imaging or getting the
patient has to take the advice of the doctor, right?
Yeah.
I think
And also-
Dr. Bhowmick can add to that. Yeah. Yes.
Yeah. So to answer to Mr. Chondo, I think what is also very important is what Professor Chakrabarti said is the quality control part. And this QC part comes in India with the accreditation symbol. So when we are kind of looking at hospitals or centers, you must look at whether they are being accredited by any Indian or international agencies. So for the normal public, if you go and buy an electrical instrument, you see the ISI mark. If you remember, people always used to say that this is the mark which signifies good quality. Same thing for laboratories, you have the NABL accreditation. For hospitals, you have the NABH accreditation. And for imaging, you have the medical imaging system accreditation by NABH. I think time has come where people can have to definitely consult their doctors, what Professor Chakrabarti is saying. Also, accreditation play an important part in healthcare as well. So there are, if you come to big hospitals like us, we have the NHS accreditation, and this accreditation ensures that you have standardized approaches in terms of maintenance of the instruments. They have to be calibrated, and you must have annual maintenance programs in place so that the patient's data is accurate every time the test is conducted. So it is very, so this information is required, and definitely if you are confused, I think you must discuss with your clinician on which are the good sites to go to.
Thank you, both the speakers. In the interest of time, we need to move on to next questions and give everybody some opportunity as well. We have 2 questions waiting for both the speakers. And may I please request participants to send the questions on your chat so we can get everybody a chance. So we'd like to move on to the next question. And this is from Mr. Bhowmick. And the question is, which is more beneficial for future in career, medical biotechnology or health analysis course?
Well, I think I will answer this question in a different way. I think beneficial is to do with interest. If you are interested in medical biotechnology, then definitely you must pursue it. But with respect to career opportunities, I would say health analytic courses definitely have an edge. Because what we are seeing currently now, and this is a very seriously sorry state of affairs, is biotechnology per se in this state, in state of West Bengal, is not fetching a lot of jobs. whether it is by BTech in biotechnology or MTech in biotechnology. So I am very sorry to say that these are very bright students, but majority of them have to change their profession. They have, because there is not much of industry in this state, and we have to accept this, that biotechnology can be only absorbed if there are chemical industries in this, there are pharmaceutical industries which are doing their preclinical work. So I personally would say that if you're interested in medical biotechnology, you should keep in mind that probably day has come where you probably have to leave this state and find other states as your home, where, because there is an opportunity for medical biotechnology in those states. But healthcare analytics, one of the surveys, again quoting, so healthcare setups, especially healthcare infotech setups, which have been which have grown up, and we know that in West Bengal there are a lot of IT industries which are located, and there is a humongous opportunity for these IT companies to kind of absorb people who will be trained in healthcare analytics, apart from good hospitals which will also require them. So my money will be on healthcare analytics at the current scenario than biotechnology.
Thank you, Dr. Bhowmick, for the answer. We have our next question from Mr. Aryaman Singh, who has asked how health analytics plays an important role in the field of in your future career. I think you've alluded to the answer, but is there anything else you'd like to add, Professor Chakrabarti or Dr. Bhowmick, in this matter?
Dr. Chakrabarti, you are muted.
Yeah. So I also feel the same as Dr. Bhowmick rightly said, that health analytics is now really coming up in a great way. Okay. That means biotechnology is more a sort of experimental and research oriented subject, which actually gradually goes into technology development, right? And if you don't have a scope of technology development, right, biotechnology, you cannot do much just learning it as a course. Whereas health analytics is much an applied subject, right, where you have a lot of scope in terms of doing research, as well as in getting connected with the entire medical ecosystem, right, and the IT ecosystem. It's a ecosystem. It's a sort of, you get the two windows. Okay, one is the health ecosystem and one is the IT ecosystem, and you do a merge of both of them. So that gives you a more wider band gap. Okay, to my opinion. Yes.
Thank you, Professor Chakrabarti, for addressing that question. Our next question is from Mr. Rohan Datta, and he has referred to Dr. Bhowmick's example in the past, and his question is regarding the efficacy and the difference between online diagnosis and offline diagnosis, and the question is whether the probability of online diagnosis may be a little less accurate as compared to that of offline diagnosis.
Yeah, so that is always an issue, Rohan, that online diagnosis might be less accurate, but you have to understand, if you read the telemedicine practice guideline of this country, the entire onus is on the doctor to initiate the telemedicine or not. So if I am having a patient who has got a chest pain, and I think that definitely it's a case of heart attack, I cannot tell the patient, okay, take these medicines, come to me after 2 days. That is my clinical knowledge, that this patient requires immediate admission and should come to the emergency. So you cannot initiate you can only initiate telemedicine in appropriate clinical condition, and there are certain medications which can be only given. The guidelines by the government of India are very clear. So we have to utilize our clinical knowledge where we can use it and where we cannot use it. And I'll give you the example where we can use it. in COVID-19 patients, where personally, if you look at the second wave, I have on record, I'm telling you, I have seen more than 800 patients in the last 4 months when the second wave was going on. And I think I could not have seen these patients if telemedicine was not possible. The only thing what you need to know is, as a doctor, your alarming signs, and these alarming signs, if you fail, then it is difficult whether you are doing it by the side of the patient or whether you are doing telemedicine guidance. We cannot afford to miss alarming signs, because alarming signs require initiation of extra support. So there is a probability definitely that the online diagnosis will be less accurate, but you have to follow it up with appropriate investigations, and if required, cancel the telemedicine consultation and ask the patient to come in person. So this entirely depends on our clinical acumen and knowledge which the doctors can utilize.
Thank you, Dr. Bhowmick. I just want to quickly ask Dr. Dey, how are we doing with time?
So I think it doesn't really matter, does it, Aparajita? As long as people are enjoying it, I guess we can continue for another 10 minutes maybe?
No worries. So we have another 2 questions over here. Thanks, Dr.
I
Dey.
think we can take these 2 questions and then we can come to the closure. Yeah.
Sure. Thank you very much, Dr. Dey. Our next question is from Mr. Ritam Mondal. Is health analytics about predictive model building or limited to data analysis part? Do we require a formal education on data science, CS, or anyone can work in this field having statistical and programming skills?
Shall I answer this, Aparajita?
Yes, please. Yes, please, Professor Chakrabarti.
Okay. Yeah, so I think, see, that means your domain knowledge is required, right? Domain knowledge, and that means you need to know at least some basic workflow, okay, in the medical practice. Okay, that is needed. So you need to work with a doctor or with a team of medical experts in some way. Either you are taking that means either in the form of a course or in terms of real practice. The second part is the analytics part. So analytics part is basically more in terms of statistical analysis. If you have a statistical analysis background, okay, with a bit of database knowledge, understanding of database, right, and computer algorithms, I think if you are fine with statistical analysis, okay, it is fine that you can also learn the algorithms also a bit. So I think more important, statistical analysis background is very perfect in this particular domain, but at some point of time you need to get aligned with the medical domain also if we are looking into health analytics. That's my view. Yeah.
Thank you, Professor Chakrabarti. We have another 2 questions before wrapping up, and we have another one from Mr. Anshuman Chanda. The question is there any post in government hospital for health analytics?
So I'll take that question. So currently the answer is no, but we have to also understand that the government has initiated telemedicine in a very, very big way. And sitting in 2021, if somebody told me that, I look back 3 years, in 2018, if somebody would have said that Indian government will pass the telemedicine law or West Bengal government will be doing telemedicine services, we would have laughed at. But that is the reality now. So as COVID, we battle COVID with each and every strength of ours. Definitely, right now standing, we don't have anything with respect to healthcare analytics in government of West Bengal, but definitely ICMR and CDAC, these are the 2 different government agencies. CDAC for sure, which is the Center for Development of Advanced Computing. Definitely they can come up with healthcare analytics. A lot of activities, and ICMR, of course, will require data to be analyzed, because if somebody, I can give the example that the vaccination data in the COVID portal is a huge database. We have now a database of 40 crore Indians there. So we will have eventual timings, but as of now, there is no such post in government hospitals.
Thank you, Dr. Bhowmick. We have the last question from Komal Singh, and the question is, I'm currently pursuing BSc Biotech. What will be the right path for me to get into health analytics as a career? Professor Chakrabarti, would you like to take on that question, please?
Okay, yeah. So, so at the present point of time, health analytics is not offered as a full master's program in most of the institutes, okay, across the country. Okay, maybe I have checked with some of the foreign universities. They have started this. But I think very soon, as Dr. Bhowmick rightly said, due to the trust of Government of India on the telemedicine, right, and also people have found that that analytics has a great impact on resource management, right? So these are the directions which are coming up in a very strong way, right, in this particular in the domain of medical study, and that will surely impact the requirement of manpower in this domain. Okay, so at this point of time, I think the right choice for you, as you are already bachelor's in biotech, and if you are going for a master's program, right, you can continue with an allied subject with the master's program, but try to come up with some courses, with some certification, okay, in this particular domain, so that you are fit to take up any challenges in the health analytics domain. That's my point of view.
Thank you to Dr. Bhowmick and Professor Chakrabarti for addressing the questions with such detail. Dr. Dey, shall we move on and pretty much go for a wrap up?
Yeah, I think it was an excellent session, and I think we will, of course, want to hear more, but then time is a constraint. So let's go for the closure. Yeah.
Thank you very much, everybody. And I'm sure if you have any other questions, we'll be more than happy to take it offline. If you could please email the questions to SHRM. You'll find the details in the registration brochure that's been emailed to you. And as of now, you'll be receiving a certificate of participation for all those who have attended this particular webinar. So look forward to hearing back from us. And once again, thank you, Professor Chakrabarti and Dr. Shubhajyoti Bhowmick, for the fantastic session. And
Thank you.
Thank you, everybody, for attending. And thanks, Dr. Dey, for the fantastic moderation. Stay well, stay safe.
Thanks to you, President. Thanks for you too. You have been a perfect host. Thank you. Goodbye. God bless you all. Thank you so much, everybody.
Bye.
Take care, everybody.
Thank you.
Bye. Take care. Take care. Thank you. Thank you.
Bye-bye.
Thank you. Thank you.
Thank you, everybody.
Thank you.
Thank you.
change
ওয়াটার বেশি এক্সট্রাকশন হচ্ছে তো ওরা তো শুনছে কত বিঘে ওরা করেছে পরিমাণ
everybody is living the meeting. তাহলে কি স্যার আমাকে বলেছেন তো আগে হাতে ব্যাপারটা হয় না একটু ডিস্টার্ব করছি না বলছি এফএসএস এর রেজিস্ট্রেশনটা কত বলি আড়াই প্লাস জিএসটি তো হ্যাঁ স্যার তাই বলেছেন কিন্তু সুজয় এক জায়গায় মানে ওখানে জিজ্ঞেস করা ছিল একজনরা কোট করেছে 1800 প্লাস জিএসটি ওদের কি করেছে হ্যাঁ তো 1500 প্লাস জিএসটি